Kohnen, Clinical Director and Licensed Marriage and Family Therapist at Grow Through Life Counseling, and we specialize in treating children and teenagers. This is the last of a video series I'm doing today about normal teen development, and then warning signs of suicide, and then protective and preventative factors, and then last but not least, which is seek mental health counseling services. So if you have a child who either online or in person has made a suicidal statement, it is imperative that we get that assessed by a mental health clinician. If that child is in crisis, meaning they're actively suicidal, they need to be taken directly to the nearest emergency room. There they will be given a psych consult within a few hours of getting into the emergency room, and those wait times obviously vary by city and state. But a psych assessment will be done and they'll be assessed for hospitalization. We're here in San Diego County, and what happens when an under 18-year-old goes into an emergency room as actively suicidal, they're assessed by a provider at that emergency room, and then they're transferred to one of two behavioral units for children and teenagers, Sharp Mesa Vista or Aurora Behavioral Health. Those are our two in the county. Sometimes there's a little bit of a wait for a bed, and the staff in the ER will coordinate that care. We also have something called the San Diego Access and Crisis Line, 888-724-7240. This is a 24-hour, 7-day-a-week access line, and you don't have to be in San Diego. You can call it from anywhere. There's mental health clinicians on the other end of that line for talking anyone through crisis, for getting them access to services, and directing them to where they need to go depending on where they're at in the severity of their depression and suicidality. So always a great resource, and many of the clinicians in the county, when you call, if you get their voicemail, because they're probably in session with other patients, you'll hear that they redirect patients to the San Diego Access and Crisis Line if this is an emergency or the nearest emergency room. So again, that number 888-724-7240. Once the crisis is stabilized, meaning there's no immediate safety danger to self or others, then typically one of those units, either Aurora or Sharp Mesa Vista, will do what they call discharge to a lower level of care. Sometimes that means day treatment, where they stay all day and do programming and then go home at night. Sometimes that means intensive outpatient, which is 3-hour group therapy a week. Or if they discharge to outpatient, that means something like Grow Through Life Counseling, where we're seeing them 1 to 3 times a week for 45 to 50-minute sessions. And we can do a lot of great work in outpatient, which if that's done consistently by parents and followed through on, a lot of times we can prevent further hospitalization. Or we can be a first-line assessor if a crisis emerges, where we can then do an assessment and sometimes admit directly to the units rather than having to go through the emergency room. But if you ever have any concerns about safety for yourself, if you're a teenager and you're concerned about your friend, or if you're a parent or a friend of a parent, please go to the emergency room, call 911 if that person is uncooperative. Something called a 5150 can be done, where the person is held involuntarily against their will if there's a fear that they might hurt themselves or someone else, so that we can get them into the hospital, get them seen the same day by psychiatrists and nurses and staff and therapists, and get them into some really intense programming to get that emotional state stabilized. And so that is a way that you can help, and that's what we want you to do in a crisis situation. And then once that crisis is stabilized, regular outpatient follow-up is highly recommended and encouraged, both by the facilities and the research supports that an ongoing relationship with a therapist is a preventative factor to future self-harm and suicidal behaviors. If we can help you, you can contact me directly at 619-549-0329. Again, 2 locations in San Diego County specializing in children and teens. One is in the Eastlake part of Chula Vista, and the second is in Del Mar/Carmel Valley near the 5 and the 56. And so we are here to help you. I do have a team of 7 other therapists, and we do have people taking new patients in both locations. So if you're looking for a provider in San Diego County, definitely give me a call. We can set you up with someone. Please check out more information on our website, which is www.growthroughlifecounseling.com. I do have a page in particular dedicated to teen suicide prevention, and so you'll find references to all the information that I've talked about today, as well as that San Diego Access and Crisis line on that page on our website. You can also like us on Facebook. We're at Grow Through Life Counseling or Grow Through Life Counseling Del Mar. You've probably found our YouTube channel. It's Grow Through Life Now on YouTube, and look forward to connecting. You can also contact us through the website if you fill out a contact form, and someone will get back to you always within 24 hours. Thank you.